Good afternoon, everyone. Welcome to CCDPH's School Health Update. My name is Kelly Jones, and I will be your moderator and your facilitator for these webinars. I am a senior health educator with Cook County Health Department, and it's been a pleasure to host these meetings. We're going to do a little bit of a change in our normal agenda as we have the pleasure of having Cook County Health Department COO, Dr. Lamar Hasbrook, on the call. He'd like to say a few words to you guys. Dr. Hasbrook, if you are here, I believe I saw you here, you may have the floor. Welcome.
Thank you. And let me get my video going here so folks can see me. So hello, everyone. So I just want to take a couple of quick minutes to introduce myself. I've been in this chair now for, I think, probably about 2 months or so. So my name is Lamar Hasbrook. I am the COO here at Cook County Department of Public Health. My background is in public health and in internal medicine, that's adult medicine. I'm also a CDC trained medical epidemiologist, spent about 12 years at the CDC, chasing epidemics and doing all kinds of other things. I've also had the pleasure of leading the state health department here in Illinois and a number of other public health jobs over the last 3 decades now. So I just want to introduce myself, field any questions if you all have any, but also tell you most importantly that one of the parts of my vision, or prominent part of my vision in terms of how we're supporting the health and the opportunities for optimal health for our community here in suburban Cook, is to really engage in partnerships in unprecedented ways. And so we consider you, school officials, school nurses, other folks who are working in the school district, one of our very important key partners. And so establishing bi-directional communication, developing things like speakers bureaus and ways to communicate, tracking all of our community partners, which will include businesses, as well as local officials, obviously the residents and others. So just defining and engaging with community partners in a more vibrant way, a more authentic way. So I understand this platform has been a really good venue for you all, and Kelly's been leading this and other members of the staff drop in. I know you have a robust agenda for today as well, but just to give you a heads up, you'll be learning a lot more about our larger community vision in terms of getting you all engaged. And we really hope to get you guys activated even more so. And we really understand that we exist but for to serve our community and our residents. And so we want to have you all help us drive the agenda as we go forward in addressing the health priorities through a health equity lens, but also making sure we can enlist your good ideas and that we're not just coming to you when we have either money for grant programs or when we're doing our planning, community health assessments to make our agenda or our strategy, or when we're sending you information about, in this case, pandemic or even monkeypox virus. So we want to have this ongoing, relationship that we want to build with you and other key partners. So that's a priority of mine. So you're going to be seeing and hearing a lot more about that in the next couple of weeks to months. So I just wanted to come on and say hello and thank you for engaging with us and let you know what's happening in the future as we can continue to move forward in assisting you with your health related needs. So with that, Kelly, if we have time for a question or two or any queries or any information you may want to know from the new leader coming in. Again, this is my third tour through Illinois and Chicago in particular. I worked at the AMA doing strategy there as well as IDPH. So if there's any questions for me, I'll field those. If not, you can reach out to Kelly and she can get to me directly. And, anytime it's appropriate, Kelly has license to invite me to join your meeting, to give you updates on our strategy or our planning, things that involve you directly or the larger community, or just to be a sounding board for ideas that you guys may have. So with that, I will say have a great meeting. And I don't see any questions, Kelly. I don't know if you see any hands flaring up. I don't see any.
I do not. Something just was in the chat. Will CCDPH be offering standing orders for albuterol to schools?
Okay. I don't know. I think you got the right people on the call today. We would certainly get back to you on that.
Dr. Corpix answered yes, and I do know that there is a unit led by Amy O'Rourke who is working on the standard operating procedures for that, and that will be rolled out shortly. I'll be sure to give you guys updates when that is finalized.
Okay. All right, so thanks everybody. Good to see your faces and look forward to engaging with you going forward. Have a good
Thank you so
meeting.
much for taking the time out. We look forward to having you on the call again, Dr.
Not a
Hasbrook.
problem.
Thank you. Welcome, everyone. I will pull up my slides. All of a sudden, I forgot how to use this and share my slides. Give me 1 second. And we will get started. I'm so glad that Dr. Hasbrook was able to take the time out of his super busy schedule to present to everyone. I'm glad that you were able to meet the face. And like he said, if you have any questions that you would like to filter, please let me know, and I will make sure that I get that to him as soon as possible. I went too far back. But welcome to Cook County Health Department's COVID-19 update for fall 2022-2023. Welcome back to the schools that started after we had our first meeting of the year. We hope you had a restful vacation. It seems like summer went by way too fast, but we're glad you are back. Our meeting objectives are to provide updates and support the schools while navigating COVID-19 and other school health issues, answer any frequently asked questions you may have, and provide contact information and resources. We sort of flipped our agenda a little bit because we wanted to welcome Dr. Hasbrook at the top of the call, but now we're up to our announcements and resources. And Dr. Jackie Corpix, who is our attending physician, will talk about pediatric COVID vaccines, and then we'll have our communicable disease update and Q&A. Few announcements. We are constantly monitoring our schedule. So if we feel like isn't as much information that we need to share with you all, we may pare down our meetings to monthly, but we want to constantly be in communication with you and make sure that we're giving you the best information and we're meeting with some substance. So if we don't feel like we have enough information to give you on a biweekly basis, we will readjust and maybe we'll go to a monthly clip, but we will certainly let you know about that. All of our webinars are recorded and they are uploaded to our website as well as our CCDPH YouTube page. We begin promptly at 2:30. We're using a different platform this year. So as before, when we had WebEx, I was able to let everyone in and you could just sit and wait until we start. We're using a different platform. So you'll be held until the lobby until we start at 2:30. I saw a few people getting off and getting back on. They probably weren't sure whether they were on or not. So just rest assured, you're on. You'll just sit until the lobby until 2:30 until we get started. So please confirm that your email address is the appropriate address that you've given because I get a lot of emails bounce back. We want to make sure everyone gets all of the information that we have to offer you. We have established a new email address if you have any webinar related questions or general questions. That's the Healthy Cook at cookcountyhhs.org. Please send all emails to that and webinar related questions the Thursday before our webinar at the latest so that we can get your questions answered ahead of time if they require a little bit of research. Also, you can still send your line list reporting communicable diseases and your metrics questions to the CCDPH_schools email address. And as usual, our Cook County Health Department website, the school's specific website, vaccine information website, and some printable communication tools that are on that website as well. Please send all EpiPen requests to me, Kelly Jones, at kjones1 at cookcountyhhs.org. Please make sure they come from a medical professional or someone who has been trained and certified on the administration of medication. Please type all of your requests. Thank you. The government COVID-19 test has been paused for the moment. My understanding is they want to hold on to the stockpile they have in case there's another rush in cases. So they want to make sure they have enough on hand when those are needed. So they have paused that program. I believe September 1st, they paused that. I believe you can still go into the store and then get your insurance reimbursed or have your insurance pay for that. And you can still find some resources at this following website. Here is Cook County Health Department's clinics, their ACHN clinics that you could go to for any of your health needs, as well as the COVID-19 shot and the booster shot is available. If you have a group such as schools who would like to go to the Cook County Forest Preserve, but transportation is an issue, I just found this resource where the Forest Preserve has an ability to pick your group up and take you to Forest Preserve events. So you can look for further information on the link provided. I think that's a great resource to schools and nonprofits. Here's just some information on some upcoming community events that are co-sponsored by Cook County Health Department. Here's another one that is happening today and the next following Fridays at First Baptist Church in Melrose Park. And another one of Glory of Divinity Church in Glenwood. You can look at all the calendar of events at our Cook County Health Department website. There are links embedded into the website. It is updated daily, so you can look and see what event that you may be able to go to. Any concerns about any testing sites, you may call the Attorney General's office and file a complaint, and an investigation will be lodged. If your school is still using the Binax rapid antigen testing, you can request test kits. A lot of people already are familiar with how to do that. And at the following link, you can get more information if you haven't done that before. Same as if you would like to shield testing through IDPH, you can send an email to the dph.antigentesting in Illinois to make a request, and they can set that up. Anyone, if you want any information about monkeypox, then you can find this information at the following website. It's provided in English and in Spanish, as well as information on vaccine and getting boosted at home in English and in Spanish, as well as it starts as young as 6 months now, as well as the destination vaccination. You can call for a ride to your vaccine. We are still trying to honor PPE requests. So at the following email addresses, you can request PPE and KN95s for your organizations. And here's just some more community resources and some material we have put together in English and Spanish. They're all printable, and you are able to put them up in your various organizations if you are interested. Information about wearing a mask, getting boosted, things you can do to stay safe. Treatment, if you find that you are positive, but you're at high risk, there are medications that are now approved that you can seek out from your doctor. So it just gives you a little information on that. I want to make sure everyone can see my screen. I'm getting some questions about seeing my screen in the chat. Feel free to unmute yourself and let me know. Everyone can see me okay? Someone says they see me just fine. Okay, just want to make sure. Let's continue.
Kelly, I can't see anything.
Who said that? I'm sorry.
Andrea.
Andrea, did you want to come out and come back in? Some people can't see me, correct?
It seems like most people can. So yeah, Andrea,
Okay.
if you want to come in, come out, might just be a connectivity thing.
Could be. Thanks, Neela.
Mhm.
Okay, let's continue on. I want to make sure I wasn't talking to myself. Okay, let's keep going.
I can see.
Okay, so more education. Thank you all for that. More educational resources and informational. If you would like to host a school clinic, you can click the link to make a request. And then here's information and tools and tips on how to host a mobile vaccine clinic. And I am going to now stop sharing and toss it to Dr. Jacqueline Corpix, who will talk to you guys about the pediatrics COVID vaccine. Thanks. Hi, Dr. Corpix.
Hi, thank you, Kelly. And I will warn everyone, Teams is being really funny. So not only are some people not able to see the screen, I've been getting randomly kicked off of it all day, despite restarting it. So if that happens, I'll just quickly come back on, or you can move on without me. But thank you. I'm just going to take a few moments of your time. Can you hopefully see my slides now?
I can see you. If you could just put it in presenter mode, it'll be a little bit easier to read, but I can see you just fine.
Oh, okay. I thought I did, but okay. So Kelly shared all the great resources that we have. We definitely want schools to request mobile clinics from us. Our rates are still quite low for pediatrics. So you can see over 80% of our total population with at least one dose, only at about 50% for fully vaccinated with booster. And which is disappointing given that ever since Omicron, we realized how important it is to be boosted. And Omicron also made us realize that vaccines for kids are incredibly important, because then we started to see a lot more childhood hospitalizations. So we're still struggling, and our focus really has been on the south and southwest suburbs to date, because we have consistently seen low rates in those suburbs. But we have made progress, which we are happy about, but we still know that we have a lot of work to do. Same with the pediatric population. Those rates have remained incredibly low, and I'll show you more specifics in just a second. So this is just our, oh, sorry, this is not this slide. This is our vaccination by race and ethnicity. And so you can see, oh, sorry, on the right-hand side, we also have a focus on our non-Hispanic, Black, and Hispanic Latinx population. So this is
I'm
the
sorry
slide
to
I wanted.
interrupt, Dr. Corpix. Your slides aren't advancing.
Oh, okay.
Did you want to
Sorry
try to
about
come
that.
out and come again?
Yeah. Can you see
Yeah.
them now? Maybe I'll
I
just
do
keep
see them
them
now.
like this.
Yes, thank
Okay,
you.
I'll just keep it like this.
Okay.
I'm having a lot of trouble with Teams today. So here's the slide I did want everyone to see. So you can see, so 5 to 11, we're at only 46% with at least one dose of vaccine, and 5 to 11, we've had approval for quite a while, and only around 39% with the completed series. And then 0 to 4, so 6 months and up, I know that just, you know, recently became approved, but super, super low. And then looking in our lowest vaccinated municipalities and their pediatric rates, as we kind of hypothesized, we do see especially low pediatric rates in our municipalities with exceptionally low rates. But that being said, we see low pediatric rates throughout the jurisdiction. So Northwest, South, and same within the city of Chicago. So just wanted to come on here and, you know, remind everyone that COVID-19 is still a problem for children. So we actually got the hospitalizations were higher than ever during this summer, lower than only the, so we had hospitalizations peak, especially during Omicron. We had deaths remain higher than influenza, and same with hospitalizations. And then we have these long COVID cases, which are affecting kids, and now we can confidently say can be prevented by vaccinations. So we definitely know that children should get vaccinated against COVID. The vaccines have undergone and continue to undergo the most intensive safety monitoring in U.S. history. They reduce hospitalizations, deaths, instances of long COVID, and missed school time, help protect each other. I am missing, I had another slide, but just kind of reminding folks that, you know, while hospitalizations and deaths have been significantly lower than adults, it's impossible to compare children and adults one-on-one because in general, children have much lower hospitalizations, deaths, disease, illness, etc., than adults do. So making that comparison one-to-one, which you'll hear about a lot of people do, is not really appropriate because kids in general, we know are very healthy, shouldn't be sick, shouldn't be in the hospital, shouldn't be dying of really anything. And so making that comparison, I've found, you know, has kind of, I think, warped the perspective about children needing the vaccine versus not needing the vaccine. So just encourage, so we've had many meetings with parents and schools and community-based organizations. And one thing we hear time and time again is that schools, especially school staff who are consistently engaging with parents and guardians and families, are one of the most trusted messengers we have. And so our ask at the health department is just that you recognize that and make that recommendation of, yes, your child should get vaccinated. And same with pediatricians, trying to encourage more pediatricians who we also know are trusted messengers. You know, your child should get vaccinated. I think a lot gets lost and, you know, you see on the news data for this, data for that. Again, like that comparison between adults and children generally faring better than adults loses the fact that children should get vaccinated and that vaccines are safe, they're effective in reducing hospitalizations, deaths, long COVID, and then even just regular things like missing school because you're sick. So in the same way that we recommend flu shots every year, and I always wish the flu vaccine rate was higher, but as definitely better than it is for COVID. COVID is still above flu when it comes to hospitalizations and deaths. And so it is something that we need to consistently be recommending to our kids and our families. And then the bivalent booster is exciting. That's approved for everyone 12 plus. We do eventually think we'll get one, hopefully relatively soon for 6 months and up. You do need your primary series first, but it doesn't matter how many shots you've had before. Everyone's eligible for this new booster, which provides protection not just from the original strain of COVID that we had, but now also Omicron. And then monkeypox, flu, polio. So definitely encouraging flu shots. September, October is the ideal time to get kids vaccinated. Those mobile clinics that Kelly talked about can offer flu. And then monkeypox, more relevant for our adolescent population or any kids who were exposed as a household contact. And then other things like polio, not an issue in Illinois currently, but we do know that the pandemic has made a lot of kids behind on their shots. And it's really schools, as a pediatrician, I know that schools are really the primary reason that most kids are up to date on their shots, because schools, enforce that you have to be up to date on your shots to start school. You have to get a school physical. So, just a general encouragement by the school, I think it does more than a lot of people realize. And so Kelly already talks about this, in-home vax, mobile vax. Like I said, we can offer flu with those clinics. You can ask us to show up at any existing events. So one idea that a school nurse had that I talked to recently was to invite our vaccine teams on site during football games, or any other remaining back to school events that might exist if those aren't already done for everyone. And then we have in-home tests that we want you to request. We have KN95s. Unfortunately, we don't have pediatric sizes for that. And then we also have this parent survey that if you're willing, and we can share the results with you, to send out through your parents and guardians to help us better understand current parent perspectives. So please, 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 request a clinic. We'll work with you. We try to make it so that you don't have to do anything on your end other than tell us time and place to show up and set up a table to give out shots. And then, please email us, email Kelly, email me, call me, whatever, if you have any ideas of how we can support you at CCDPH. So that's all I'll say now, and I'll put my contact information in the chat.
Are there any questions for Dr. Corpix?
Okay, thank you.
Thank you. Feel free to reach out if you thought of something after the fact. But thank you, Dr. Corpix. We appreciate you taking the time out of your schedule. We'll make sure we share those slides with the staff. I'm sorry, with the school staff who's participated. Thank you so much. And we are going to welcome Sheila Giovanni, who is the Director of Vaccine Preventable Diseases with Cook County Health Department for a Communicable Disease Update. You have the floor, Sheila.
Thank you so much, Kelly. I appreciate that. And thank you, Dr. Corpix. Before I get started, I must ask, can everyone see my screen? And can everyone hear me okay?
I can see you. Is everyone seeing the slides? Okay. Yes, we got a few yeses.
Okay,
it may be
great.
A little bit
Thank
easier.
You. Thank you very much.
No problem. Thank you.
So welcome everyone to our COVID-19 school operational guidance and our CCDPH new reporting process presentation. As Kelly mentioned, my name is Sheila Giovanni, and I am the Vaccine Preventable Disease Program Manager. And I am so excited to, one, welcome you back, two, to go over our new guidelines from CDC and IDPH, as well as talk about our new reporting process. Before we get started, I do want to go ahead and give you an overview of what we will be discussing today. We will be talking about our COVID-19 community metrics, as well as our school guidelines. We will focus on new changes, and we will talk about our everyday preventive strategies, which are up to date with vaccinations, improving ventilations within schools, staying home when sick, when to isolate, and of course, we will talk about hand hygiene and respiratory etiquette, as well as cleaning surfaces within your respective schools. And we will conclude the webinar with a new introduction of our COVID-19 reporting process. I hope to spend a little bit of time diving into our new process. So I'm going to go ahead and move along, keeping in mind with time. So let's go ahead and talk about our new changes for our COVID-19 2022-23 school year. So quarantine is no longer required for those that have been exposed to COVID-19, and test to stay is no longer recommended because it was based around our preventive strategies of quarantine. So since quarantining is no longer necessary, test to stay is no longer recommended as well. There will be no need for cohort settings within your respective school, and contact tracing is no longer required. Our primary focus will be on promoting when to wear masks, managing cases and exposures, and responding to outbreaks. And of course, we will focus on screening tests for high risk activities, specifically in high community levels. So before we get started specifically into the guidelines, I do want to take a moment to bring your attention to the screen before you. Some of you may very well be aware of this, and many of you may not. But this is our COVID-19 Community 19 metrics, which is our surveillance data, and it is housed on our school webpage, in which you can find daily. It is updated Monday through Friday, and it is specifically for our suburban Cook jurisdiction community for our COVID-19 levels. Here you will find our cases per 100,000 within the last 7 days. You will find information on our hospital admissions, as well as our hospital beds occupied by COVID-19. But most importantly, you will find our community level. And again, this is specific to our Cook County suburban jurisdiction level, which currently is at low. I have provided the link for you so that you can go here daily if you like. But I do feel it is significant to point out that you may see a difference in between our community level and what CDC has reported in regards to our overall totals. And that is because CDC also incorporates Chicago, as well as our independently operated Cook County departments, Evanston, Oak Park, and Skokie, and Stickney Township. And that will definitely make the numbers look a little bit different in regards to the comparison. So if you're looking specifically for your area in suburban Cook County, we invite you to visit this page daily. Again, from Monday through Friday, our numbers are updated accordingly. So I want to spend a little time talking about the community COVID-19 levels. Again, this is a tool that was provided by CDC in regards to individuals and communities being able to monitor their COVID-19 levels respectively. And as you note here on the chart, you'll see low, medium, and high. And then it gives preventive strategies of what needs to be done with each community level. So for all community levels, masking is definitely recommended. And it is also true that for nurses within school office settings, that they must continue to wear a mask. From the medium level and high, again, if you are a person that has immunocompromised, or if you have family members or within your social circle that are immunocompromised, we do ask that you prefer or recommend wearing a mask during that time. If it is at high within your respective community, we do recommend university masking for indoors and publics. So this does include schools as well. And this is regardless of one's vaccination status. In regards to tests, diagnosed tests for community levels are recommended. Again, for high community levels and specifically high risk school activities and after school breaks, we do definitely recommend screening tests as well. In regards to outbreaks, we do recommend that screening tests should be implemented in response to outbreaks, as well as making sure that you are following this specific code in regards to our community levels. And lastly, we will discuss our management of cases and exposures. Again, people with COVID-19 should stay at home for at least 5 days, wear masks for 6 to 10 days as symptoms improve and there's no fever within 24 hours without any fever reducing medication. And then people who are exposed to COVID-19 should wear a mask for 10 days and get tested on or after day 5. So as Dr. Corporate has just mentioned before, vaccination remains the strongest way to protect yourself, your children, and your family from COVID-19. As of today, there has been more than 8 million Illinois residents who have been fully vaccinated against COVID-19 um, through the booster and or the vaccine. So with that being said, we want to make sure that we are continuing to focus on the importance of being vaccinated and staying up to date with your vaccines. So in regards to Section 3 of Illinois Executive Order 2122, it was reissued and it is in effect. And this order is in place in regards to school personnel who must establish that they are fully vaccinated against COVID-19 or they must submit to a weekly COVID-19 test. This order has been extended and is in effect through September the 17th of 2022. As Kelly and Dr. Corporate had just stated previously in regards to some wonderful things that your school can do to make sure that you are promoting and encouraging vaccinations within your school. Some of them are provide information about COVID-19 vaccinations. Again, CCDPH have a wonderful list of resources and materials that you can find. We want to make sure that the schools are supportive of policies and practices to make getting vaccinations easy and convenient. And again, we want to make sure that we are providing resources in which schools can host local events within their specific school area. So that would be a great opportunity to take advantage of our mobile van to see if they can come out to your school, all in regards to keeping one safe. So we ask that you continue to promote and encourage our COVID-19 vaccines. As stated, they are very safe and effective. So what does it mean to be up to date? CDC recommends that COVID-19 primary series vaccinations for everyone aged 6 months and older, and COVID-19 boosters for everyone 5 years and older. Of course, people with moderate or severe immunocompromised diseases may have specific recommendations for COVID-19. As it is noted, we are expecting another booster very soon. This will be extremely important to make sure that you are staying up to date with routine vaccinations, which are essential to prevent illnesses from many different infections, including COVID-19. So I want to take a moment to talk about the improving the ventilation within the schools. So moving air is extremely crucial to bring in good quality air for our schools and our staff personnel. So in doing so, we're asking that when possible, if you can have activities outside or lunch outdoors when circumstances allow. We ask that if you can open windows and doors whenever the weather is permitting and use child safe fans to increase effectiveness of open windows. Again, it is to make sure that we're also focusing on the air quality within the school, of making sure that We are using portable air cleaner and making sure that the ventilation and air conditioning systems are working. So you can do your due diligence in this part, and is making sure that if you're going to open a window and you notice that that window needs repairing, or if you're going to adjust the thermostat and you notice that it may not be working correctly, or if you do not have a child safe fan within your room and you would like one, these are ways that you can improve ventilations in school. And the American Rescue Plan has dedicated over $150 billion for this initiative to help make sure that schools with allowable expenses, if I may, can use some of the funds to purchase fans to test and inspect the maintenance of the ventilation systems, to repair windows and doors, just to name a few on here. I have provided the link for you below in regards to finding out a little bit more information of how the American Rescue Plan can be utilized, and some of the funds that are allowable expenses that can help improve help improve ventilation within school settings. So please reference this link. I think it would be most helpful. So staying home when sick is extremely important. It is important because it helps lower the spread of infectious diseases like COVID-19 and others, but it's also equally important to make sure that you're keeping others safe. It is recommended that when you are sick, that you stay home within at least the 5 days, because that is when you are most contagious. We definitely want to make sure that schools and ECE programs adopt and promote flexible, non-punitive, and supportive sick leave policies and practices that are compliant with applicable laws and regulations. And also, policies should be communicated and understood by employees and the parents and the communities in the school and the early childhood education. So not should the policies only exist, they need to be available and understood by each one of the staff and the schools, that this is available for them and that they are supportive of these practices. So we're going to talk about the new guidelines and when to isolate. So I'm going to point out a couple of things here that I think is significant. Again, this information is available on our website, as well as CDC and IDPH. But the new guidelines in regards to when to isolate focus specifically on regardless of your vaccination status. You should isolate from others if you have COVID-19, or if you suspect that you are sick with COVID-19, but you have not received your test results. We are asking that you isolate. So if your results are positive, we're asking that you follow the full isolation recommendation below. But then if they're negative, you can end your isolation. So let's talk a little bit about that, what that looks like. So if you had no symptoms at all, or if you have no symptoms after your 5 days, you may end your isolation after day 5. If you had symptoms, you may end your isolation after day 5 if you are fever-free for 24 hours without the use of fever-reducing medication, or if your symptoms are improving. If you still have a fever, or if your symptoms have not improved, you need to continue to isolate until they have improved. Removing your mask. This again is a new guideline from our IDPH that states that after you have ended isolation and you are feeling better with no fever reducing medication and symptoms are improving, you can wear a mask through day 10. Or if you have access to 2 antigen tests, you should consider using them. You can take 2 sequential negative tests within 48 hours apart. Then you may remove your mask sooner than 10 days. If your antigen tests are positive, you still may be infectious. So you should continue wearing your mask for at least 48 hours before you take another test. If you continue taking antigen tests at least 48 hours apart until you have two sequential negative results. So this may mean that you may need to continue to wear your mask and test beyond day 10. The direct link to this specific guideline is provided below as well. Our next slide is from our partners at IDPH. They utilized this on their school webinar on August the 16th. And this graph illustrates the new process of isolation and providing a perspective on the last three slides that we discussed. I believe that this slide is extremely user-friendly in regards to breaking down when you can end isolation by taking two antigen tests, or if you are fever-free. This slide provides all of the information that you need to decide what steps you should take in regards to your COVID-19 exposure. So I will have this available on our site for you to utilize, or you can always go to IDPH website for this user-friendly guide as well. So next, we will just talk about, again, some of the hand washing and cough and respiratory etiquette that is a strong recommendation from IDPH that we're asking that schools continue to promote hand hygiene within the schools, making sure that children and staff are washing their hands for at least 20 minutes, and especially during like recess time before and after a meal, and also restroom time as well. We're asking that hand sanitizer with at least 60% alcohol is available. And we are also recommending that that you continue, if I may, to place visual cues such as hand washing posters or stickers or other material in highly visible areas throughout the school. And keeping in line with that, we are also asking per CDC recommendation that we continue to ask the schools to clean surfaces at least daily, especially those high touch surfaces. And we're also recommending for early childhood education programs that they're cleaning and sanitizing and disinfecting specific settings, specifically after diapering, feeding, or exposure to body fluids is recommended. So we are excited to announce our Cook County Department of Public Health COVID-19 school reporting process. And I do want to take a moment to pause to thank our schools for all of their steadfast commitment and dedication that they have shown throughout our COVID-19 response. We identified how challenging our daily reporting has been for you. So we're truly excited to offer weekly reporting. So I want to take a moment to dive down specifically in regards to our new COVID-19 school reporting process. So before I get started, I do want to let you know that our documents are available on our school health page for you. They are available for you to utilize currently right now at this time. So our weekly reporting consists of two tabs. I want to be very clear as our Excel document. It consists of two tabs. One of the tabs is our weekly reporting, and one of the tabs is our school outbreak tracking form. For the weekly reporting, we're asking that you submit that at least, of course, weekly on Friday or whichever day that you pick that works best for you, long as it's consistent on a weekly basis. We're asking school to input their school contact information, which will be your school name, the district that you belong to, contact information, along with phone number and email for you. And then we're asking that you provide us with a number for your lab and provider confirmed cases. Here under our weekly reporting, you do not have to report home tests. Under the new lab and provider numbers, you can report, of course, physician confirms positive results. If anyone is using Shield testing, you can report that there as well. And the BioNext Now tests are also, if done by a healthcare provider, such as a nurse within a school, can also count for our number of lab and provider confirmed cases. And then we provided you with a note section in which you can provide us with any information that you want in regards to if you're noticing specific clusters or specific high risks and some activities within your school, or I noted that some people have been putting in some of their different schools information in there. Anything again that you want our school team to know, you can post there in that regards. The second tab is our school outbreak tracking form. This tab again is very different from our weekly reporting tab. This is to notify us of an outbreak within your school. So if you're noting that there is a significant number of cases that meet our outbreak definition, we're asking that you go to this tab and report that information to us. And we're asking that, of course, the health department be notified of this immediately, and that you're just providing information again as like the first case and then the last case, and like classroom information, the teacher's information and the grade level as well. We are asking for numbers, not individuals' demographic information with these two specific reporting documents. We also have provided for you as a best practice our COVID-19 school line list. And this is a simplified version of the school line list that most of you are very familiar with and have been reporting for the last 2 years or so. On this list, we simplified it and we posted it back on our school website for you to use at your leisure for internal use only. We do not need the COVID-19 school line list submitted to us, but this is a great way if you do not have a tracking system already that your school is using to gather the demographic information of those COVID-19 people, the symptoms of the onset, the COVID-19 test date, and also like the student return date is also important for you to note. Again, I want to be extremely clear that we're not asking you to submit the COVID-19 school line list, but it is a good tool for you to use for internal purposes. So going back to the discussion of the school outbreak tracking form, I do want to note that if you are tracking school outbreaks, home tests are okay to include. We ask that you include that. So if you look at the document that is provided for you, there is a column that also asks the number of home tests. But for your weekly reporting, we only want lab and provider confirmed tests.
Sheila, sorry to interject. We have 10 minutes left and we want to make sure we have time for
Okay,
Q&A
I'll
before we
move right
end.
along. I'll move right along. Thank you. So the next slide focused on our outbreak definition. Again, it is in work for some modifications to this definition, but currently this is our outbreak definition for pre-K to 12th grade. Again, I will just leave this here for you. It will be available on this slide deck that will be presented to you. But of course, we're looking for multiple cases comprising of at least 10 students, 10% of the students, teachers and staff within a specific core group, or at least 3 cases within probable or confirmed within your school associated COVID-19 setting. So I'm going to go ahead and conclude This presentation with providing you with our school email address. Our school team is readily available to answer any questions, feedback, or comments that you have. We do ask that you email us here under this direct address. We will be able to respond to you more quickly. So thank you again so very much for all that you have done and you're continuing to do to keep our schools and our community safe and healthy. Thank you, Kelly.
Thank you guys so much. I'm scrolling back to the top to make sure we didn't miss any questions. Michelle and Tark and Dr. Corpix has been great about answering questions. So we may have gotten everything, but we just want to make sure. There's a question about CCDPH offering standing orders for albuterol, and that will be rolled out soon. We're in the process of working on that. So I believe at the next school health meeting, I should have information and we should be able to get a presentation on that on the agenda. So we'll be able to let you know all about that. And also, I see Andrea Zito asks about funding for free albuterol stock. I'll make sure I ask about those resources as well. As of yet, I am unaware of any resources, but we will find out if there is anything. There's also a question about offering glucagon. I have not heard of any legislation mandating that we offer glucagon, but I will definitely bring that up and we will see if we can also offer that. If that is the case, it will take some time to roll out the standard operating procedures just as the albuterol, but we will keep you posted with that. I believe all the rest of the questions have been answered, so I'm going to scroll down towards the end. Is there a specific response time to questions submitted via email by schools? I think Michelle answered that. Is that correct? Oh, Tarek, I see it. We try our best to answer all questions within 24 hours from the time the question was received. And Rebecca Boston is interested in Narcan. When you get the email sent with the slides, it'll have information on all of our resources as well as the contact person. Her name is Denise, who you can request Narcan from. So all that information will be in the slides. Michelle, please hop in and let me know if there's anything that hasn't been missed.
Hey, so I think there's two questions
Sure,
that I missed it that I was going to type in the answer. For the reporting, you do not need to report home tests. In fact, if you're not sure where the tests come from, just consider them a home test and only report tests that are either done by a provider or the parents state that it was a confirmed lab test. And the reason why, we don't need home tests is one, our management told us we didn't need to. And second, we're trying to match it with the numbers that are reporting in from our lab just to see if we, how well we're doing with matching up with our lab reports. I think there's a new message.
Okay.
Oh, do home tests count in an outbreak? Yes, home tests absolutely count for an outbreak. And those are the only time that we do want the home test reported, and you will see it on the second tab that we actually listed it. Please report your Shield lab report. I know Shield is reported to us, but the tricky thing with Shield is they don't often report with the school name. So while we know this person is positive, we cannot always connect them to a school. And since we're only asking for one number, I think that's very reasonable that we're asking for a total number of test results. And I think I cover everything.
Thanks, Michelle. And I also saw that there were requests for my and Dr. Corpix's email addresses. We put them in the chat, but in case it got lost in a thread, Dr. Corpix is jkorpics@cookcountyhhs.org. And my email address is kjones1@cookcountyhhs.org. Feel free to reach out to us with any questions or concerns, and we'll be glad to steer you in the right direction. If there are no other questions, there is a question that just came in. About Shield. I think you already answered that, Michelle. Yes, about Shield and home tests. If there aren't any more questions that we can answer, we are going to adjourn. I'll give it another minute in case there's a question that comes into the chat. But otherwise, we will reconvene September 23rd. We are on a bi-weekly status as of now for at least the next month or so, and then we'll reassess to see if we need to pare down to a monthly status, but we will let you guys know about that. But until then, we will see you bi-weekly, and our next meeting is September 23rd. I'll be sure to send out all the slides and those resources next Monday. And unless there aren't any other questions, I want to thank Dr. Hasbrook. It was refreshing to see him on the call. I'm glad he was able to find the time to speak with us. I want to thank Dr. Corpix for taking the time out to talk about the pediatric COVID vaccine cases, as well as the communicable disease department, Sheila, Michelle, and Tarek for their assistance. We will see you all at our next meeting. Feel free to reach out with any questions. Thank you and be well. Have a good weekend. Thank you all.